Do you know? Authoritative survey data shows that the elderly aged 65 and above account for 37.6% of the total number of patients admitted to medical institutions throughout the year. In the face of the accelerating process of global aging, the market demand for precise and elderly-friendly medical services is growing geometrically. It is worth noting that this group generally has multiple underlying diseases coexisting, which requires the medical system to build a multidimensional integrated care system. Human organs will experience functional decline with age, and this natural evolution significantly increases the probability of various degenerative diseases. Common health threats covered for major areas: cardiovascular and cerebrovascular diseases, metabolic syndrome, osteoarthritic degeneration, and cognitive impairments. However, it is reassuring that through early intervention and health management, relevant hidden dangers can be effectively avoided in most cases. Scientific health management requires the construction of three pillar systems. 1. Periodic physical assessment, including annual physical examination items, special disease screening, and preventive medical interventions. 2. Full cycle health records. Establish a long-term mutual trust relationship with the attending physician and maintain continuous tracking of medical information. 3. Preventive lifestyle. Regular physical exercise, 150 minutes of moderate intensity per week, a Mediterranean-style dietary structure, and regular psychological state assessments. Special reminder: any subtle physical signal is worthy of attention. It is recommended to accurately describe the details of the symptoms when seeking medical treatments. Develop the habit of keeping a health log, which is important reference value for the early diagnosis of diseases. Key screening items: it is recommended to conduct dynamic blood pressure monitoring, glycated hemoglobin testing, and tumor marker analysis every year. Cognitive function maintenance: it is recommended to participate in intellectual activities such as bridge and Sudoku, and maintain social interactions 3 times a week. Principles of medication management: establish a medication memorandum and regularly check for drug compatibility contraindications. Modern medicine has confirmed that the level of health literacy directly affects the effectiveness of chronic disease management. It is recommended to improve health awareness through the following channels. Participate in the silver-haired health lectures held by Class A tertiary hospitals. Subscribe to the popular science columns of authoritative medical journals. Master the self-taught skills of basic vital signs: blood pressure, blood sugar, body fat percentage. To establish efficient doctor-patient communication, 3 key points need to be grasped. 1. Preparation before seeking medical treatments. Organize previous examination reports and list the questions for consultation. 2. Communication skills. Use a symptom diary to assist in description and make good use of analogies to explain discomfort. 3. Follow-up. Clearly define the time nodes for follow-up visits and understand the channels for querying test reports. Special warning: the elderly aged 65 and above often tend to understate their symptoms when seeking medical treatment, which may delay the best diagnosis and treatment opportunity. It is recommended that accompanying family members match to the symptom magnification statement method to ensure that the medical team can accurately judge the condition. The Health Self-Care Guide for the Silver-Haired Generation, breaking down the barriers in medical consultation. Many silver-haired people often attribute their tiredness to the passage of time or regard the discomfort of their bodies as an inevitable part of life's ups and downs. These seemingly ordinary physiological signals are actually health warning signs sent by the body. It is worth noting that 36.7% of elderly patients misjudge their symptoms according to the data in the 2023 Silver-Haired Health White Paper. Regular physical examinations and in-depth conversations with the attending physician are the keys to capturing potential health risks. Breaking the myth: the cognitive gap in professional terms. The professional terms often appearing in clinical diagnosis and treatment often form a barrier to understanding between doctors and patients. A recent survey shows that the accurate understanding rate of medical terms among people aged 65 and above is less than 42. This directly leads to the problem of medication compliance in 38% of elderly patients. It is recommended to adopt a 3-step communication method. Actively request a popular explanation. Repeat the key points of the medical advice for confirmation, and establish a personal health memorandum. The wisdom of communication across physical limitations. The physiological changes related to age may become obstacles to diagnosis and treatment. For vision decline, a large print manual can be requested. And for hearing loss, a hearing aid can be used to record simultaneously. The system of accompanying patients to seek medical treatment is worthy of promotion. Family members can not only assist in information recording but also provide a perspective of life observation. Clinical practice has proved that using the dual-track communication mode of chart, display, or oral repetition can increase the accuracy rate of medical advice implementation by 67. The active management list of the quality of life. Medication safety, pay attention to adverse reactions and drug compatibility contraindications. Precise screening, individually formulate the physical examination cycle. Health intervention, customize exercise and nutrition plans. Chronic disease recuperation, strategies for preventing complications. Psychological care, integrate emotional counseling resources. Advanced medical directive, express medical wishes at the end of life. Model case, Helen, the messenger of silver-haired vitality. Helen, a 72-year-old community health ambassador, owes her vitality management secret to building a medical think tank. Her health triangle consists of 3 morning exercises per week, gardening work in the balcony vegetable garden, and parent-child time with the younger generation. A specially equipped medical file box stores her medication list, examination reports, and health diary, enabling efficient communication during each medical visit. This systematic health management has made her physiological age 9.6 years younger than her actual age, comprehensively evaluated by a Class A tertiary hospital. Every stage of life deserves to be treated gently, and the health protection in the silver-haired period requires more wisdom and skills. Establishing a medical partnership, making good use of auxiliary tools, and maintaining active communication. These 3 protective nets can help the elderly overcome the obstacles in seeking medical treatment. Remember, high-quality medical care is not only the responsibility of doctors but also a required course for every person who is the first responsible for their own health. The revelation of Silver Age health management, the diagnosis and treatment inspiration of a vital elderly person. These seemingly ordinary daily activities are important bonds for Helen to maintain her vitality of life. The morning brisk walk is her ritual of communicating with nature. The gardening work carries her off for life, and the interaction with her grandchildren is an important source of emotional energy. However, the frequent occurrence of abnormal tiredness and shortness of breath recently has cast a shadow over her rhythmic life. It is worth noting that the misdiagnosis rate of such nonspecific symptoms among people aged 65 and above is as high as 41 to 8. Source: Clinical Observation Report of Geriatrics for the year in 2023. Unlike most elderly people who choose to remain silent, Helen has demonstrated the health management wisdom of the modern silver-haired generation. When the symptoms first appeared, she did not simply attribute them to physiological aging but established a self-monitoring log that includes elements such as the frequency of symptom occurrence, duration, and inducing factors. The 12 key data recorded over a 2-week period have become an important basis for subsequent diagnosis and treatment. When making an appointment with a cardiovascular specialist, Helen ingeniously prepared a 3WH consultation list with the nature of the symptoms, why the source of the inducing factors, weigh the solution, how the implementation details. During the diagnosis and treatment process, she used the STIR narrative method to accurately present the symptoms, specific manifestations of situation, test daily activity level, action respiratory compensation method, and results recovery time appeared at the 18th minute of the morning exercise. The diagnosis of early cardiac insufficiency subverted Helen's perception. The medical team tailored a 3-dimensional intervention plan for her. Medication regulation plan, including a time-sharing medication system of morning blockers, night diuretics, exercise prescription changing, continuous walking to intermittent aerobic training, nutrition reconstruction plan, increasing the dietary supplement of coenzyme Q10, cooperating with the monthly detection of cardiac function biomarkers to form a closed loop of dynamic health management. The ripple effect of this medical encounter far exceeded expectations. The Silver-Haired Health Mutual Aid Association, established by Helen, has developed 83 core members and uses the PDCI cycle plan to act for chronic disease management. The medication list template in a medical file box has been adopted by the Community Health Center, benefiting more than 2.0 elderly residents. The essence of modern medicine is a collaborative project of knowledge co-construction. the symptom perception aid at the patient end, and the professional judgment at the physician end from a diagnostic double helix. It is recommended to establish a 3C communication mechanism: clarify the demands, confirm the understanding, consensus reach consensus. For example, use a symptom visualization scale to convert subjective feelings into quantifiable data. Symptom recording: use a health notebook to record the 5 elements of symptoms: time axis, intensity change, environmental correlation, relief method, impact on life. Preparation for medical treatments: construct a framework of 3 health questions, basic questions. Doubts about the treatment plan. Preventive consultation. Information retention: use the voice-to-text function of a smartphone to generate medical consultation minutes. Effects tracking: establish a health effects coordinate graph for medication, exercise, diet. The medical journey of each elderly person is a precious health database. When Uncle Zheng, who is 78 years old, shares his medication compatibility confidentiation list, and Aunt Li, who is 63 years old, publicizes her blood sugar fluctuation curve. These practical wisdoms are constructing a knowledge map of elderly health with Chinese characteristics. Are you willing to become a node in this life care network? Please leave your health management experience in the interaction area. Your health narrative may become a guiding light for others. Whether it is a successfully resolved medication crisis or an epiphany moment in medical consultation communication, every real story is reshaping the warmth of medical services. You are invited to be the initiator of the health dialogue and open a chapter of medical humanities belonging to our era in the comment area. Remember, every candid communication is a vote for the quality of life, and every positive question is writing the future picture of silver-haired health.